Tonight, a major victory for abortion opponents tonight in Tennessee.
Healthcare providers that offer a certain number of elective abortions could soon face the loss of Medicare funding. Medicaid funding, that is. Caroline Corrigan found out that's if the federal government grants a waiver to the state of Tennessee.
Josh, the bill asks the federal government to give Tennessee permission to essentially cut off TennCare funding to any clinics that perform 50 or more elective abortions a year. The group Planned Parenthood told me that will hurt women, many who need health care and aren't seeking abortions.
Authority is adopted. Without objection, the motion reconsider is hereby tabled.
The actual votes took place weeks ago, but on Wednesday, Governor Haslam signed it into law. House Bill 2251 says it's against Tennessee policy to use state funds to promote or support elective abortions. So the bill calls for the state to get a federal waiver to exclude any provider from TennCare reimbursements if the funds could directly or indirectly promote or support elective abortion.
I found in research that nearly $1 million state dollars have been paid to abortion clinics in Tennessee in the form of TennCare reimbursements over the last 6 years. This money is a form of supporting abortions.
Democrats in the Senate disagreed, saying the cut in reimbursements will have a negative impact on providers of women's health services.
Why would we want to limit and cut back on the number of providers where women can get a well woman visit?
The bill doesn't mention Planned Parenthood, but many think it's the target of the bill. The closest Tennessee Planned Parenthood clinic is in Knoxville.
Patients should be able to go to the providers of their choice. State, the federal government, as long as these are qualified health centers, there's no reason that they should not be able to go to them.
Lawmakers who voted to defund said other options are available for women needing non-abortion related care, but Planned Parenthood disagrees.
A lot of times they're booked, and even times that they'll say that they're not even taking new patients. So if someone has a particular condition that they need to get into the doctor right away, they don't have that opportunity.
But that wasn't the majority opinion. One East Tennessee lawmaker told me he thinks clinics that perform abortions should be excluded from state funding.
There's no reason for any tax dollars to go to a facility that does something like that.
This is the latest step in what's been a process that began 4 years ago when Tennesseans approved a constitutional amendment that removed the right to an abortion from the Tennessee Constitution.